My name is Dr. Torabi. I'm an interventional cardiologist at Franciscan Physician Network, and I'm at the Crown Point and Munster campuses. It just depends on your severity of your heart valve disease. For a lot of patients, they sometimes don't even know they have it, and that's why we really encourage folks to have primary care physicians and providers and nurse practitioners that can sort of kind of monitor that. And for patients that have mild valve disease or even mild to moderate valve disease, we're still encouraging them to be as active as they can be and live a very physically active lifestyle. So just because there's mild to moderate disease, it doesn't necessarily mean that we want to have patients stop being active. Now, patients that have severe valve disease, whether it's trouble where the valve is too tight or it's severely leaky, a lot of these patients are going to have symptoms, and probably not the best idea to go out there and to push yourself too hard. And that's really kind of one of the first signs where we really actually encourage that maybe we should do something about this valve and take care of it and get it either repaired or replaced. For patients that have had any sort of valve repair or valve replacement, we typically are not having them go out on their own right away. Usually what will happen is they will see our surgery team typically in about 2 weeks from their procedure, and they will do an incision check, groin check, and make sure that patients are doing all right. And then usually I'll see them at the 4-week mark, and typically that visit is to get a repeat ultrasound of the heart to make sure that the valve is functioning beautifully and the heart squeeze looks okay. And if all those parameters are checking all right and the patient's feeling better, then typically what we'll recommend is that they go and start cardiac rehab. Now, the best way to think about cardiac rehab is it's supervised exercise. You're there with trained healthcare professionals that are going to walk you through specialized workouts for the heart, and you're going to be monitored. They'll be checking your blood pressure and your heart rate, and it's really a wonderful thing to do. I know we have a lot of patients out there that are very independent and they like to do their own workouts, but what I tell folks and patients all the time in the hospital, and particularly in the office, is if they can even just go for 1 to 2 visits and just learn what the exercises are, and if they want to start doing them independently on their own, they can. And I think they can do a really good job of it, but at least go for the first 1 to 2 times. Now, what usually happens for a lot of patients that have had their valve worked on and they go to cardiac rehab, they end up really liking it and they want to finish the whole thing. And I think when they get through these training sessions with the physical rehab team, they tend to gain some confidence, and it's sort of kind of a mental barrier that they're able to kind of get past. And then once they get through cardiac rehab, we're really not putting any restrictions on our patients. I'm letting them go and just be as physically active as they can be. Typically, when we see patients in the office and we want to know what's their, age-related, maximal heart rate, usually we do, 220 minus their age, and that typically is a nice rule of thumb for, the heart rate or how high to push it. But, it really ultimately goes down to the patient, because the patient knows their body really well, and they know their body best. So typically, if there's a patient that's noticing that they have, they're not sure if this is just deconditioning or that's just a fancy way of saying you're out of shape, they come see us in the office. We're listening to their heart, making sure there's no murmurs, getting an echocardiogram, and if the valves look okay, and if there's no evidence of any blockages in the heart, then typically we're giving patients a reassurance that that they're probably all right. But I think that's really where it comes to play, where if you don't have a cardiologist, you really need to have a really good primary care provider. So when you're out there working out and trying to live a very active lifestyle, and we have spring is here and summer is around the corner, we have a lot of patients that are really motivated. They want to get back out there. They want to be active, and we want them to be active. But if they're noticing a change, and I really say this to a lot of our older patients, that you really shouldn't chalk up any changes in your exercise capacity or changes in your breathing to just your age. You should always be seen by a physician or a nurse practitioner or a PA or an advanced practitioner. And if they've done the preliminary workup and there's something that's not normal, then we're going to go in and we're going to do the appropriate workup.